Good morning, team. Just wanted to say thank you for all the hard work this week. We are about 150% more patients this week than we had in the last 2 months, so consistently over the last 5 days. So I know you guys are busting your butts. Keep it up. It's truly a direct reflection of all the hard work that you guys are doing for how many great comments that we're getting throughout the hospital trisses and the Pulse of the Eagle Awards. Just wanted to go over some quick notes for you guys. No more shipping boxes are to be stored in the clean room in room 75. If they have a shipping label on them, because it's a clean room, we can't actually have the shipping boxes in there because they're considered dirty. Talked to Marshall A about it, but her and Ms. Liverman should take take lead on making sure that any of those contents are just placed on the shelves correctly. Whoever's doing the ordering, if we have excess of any equipment that we're not using or supplies that we're not using, please make sure that you're turning it back in the DA form 3161. EKG leads need to be placed in bags. This isn't a new thing, but make sure that we're putting a date that we open the bag on, and if it exceeds more than a month, make sure that we're throwing those EKG leads away. I've talked to infection control about our call lights and how they have those old kind of grimy cords on them. I'm gonna get with Sergeant Wooderson next week and to see if we can order some new ones. If a room hasn't been occupied in more than 7 days, please charge nurses. Please make sure that those rooms are just cleaned by housekeeping before we put another patient in there. So if our checks are saying more than 7 days ago, make sure that those rooms are re-cleaned or just re-inspected to make sure that they are still clean. Make sure that we're not placing anything as far other than food in the patient fridge and freezer. We had some ice packs in there, went ahead and removed them, placed those ice packs in our personal fridge. So if anybody's looking for those, that's where they're at. And just to make sure that we're not mixing medical equipment and actual food. Over the next few weeks, we're going to actually get the Pyxis system up and running in our supply room. The implied task is that I'm going to need each and every nurse for once the system is up and running to be pushing the button as far as whatever item that you're removing from that system, because it will have a reorder line, and if we're not hitting the button, we're not going to get the reorders. I'm working with Marshall A, and I'll be working with Ms. Liverman as far as the reorder points, and when they feel like everything should be appropriately stocked. But we are going to be rearranging that room as well to make a little bit more sense of to have like items together. We do have some new customer service training that's coming down the pipe. I truly believe in it. It's evidence-based. It sounds a little scripted sometimes, but when we start using this verbiage with our patients, it is shown to really significantly increase our TRIS scores, which is really important to us because our TRIS scores are what the hospital gets paid on as far as customer satisfaction. So I know it might seem a little scripted. I just ask that everybody kind of buy into it, and let's just try it out, see if it works here on our unit, and see if these scores are actually reflected to the training that we're going to receive from Ms. Fuller. I will send out some PowerPoint slides on it, and I'm just excited to see if it works here on the unit. We are due to get 2 to 3 more surgeons. I think 2 of them reported this month. So we should expect an increase in our surgical patients that we have throughout the week. So more to follow on that, but we should start seeing a good steady of back to our old normal amount of surgeries that we've been seeing throughout the day. There's going to be a new DCN that comes on board somewhere between October and November, just for your situational awareness. And just continue to do the great things that everybody's doing. I know staffing is going to be a little tight. We do have a medic that's coming to nights throughout the week. Hopefully that lightens the load for the night shift. We do have a lot of new employees coming on board here in the next couple months, almost 6 or 7 of them actually. So just welcome them with open arms and show them the way the right thing is for AB. And just once again, thank you for all your hard work and dedication. I am truly blessed to be part of this team, and I'm really happy with everything and how the direction that we're going on this unit.